We still got some great stuff coming up for you this afternoon. Our next topic of discussion is 4 years into long COVID. What's the impact? As we sit down all together today, no masks on our faces. It's hard to believe it's been 4 years since the COVID-19 pandemic first turned all of our lives upside down, right? Now we're here to tackle a topic that's still very much on our radar. 4 years into long COVID. What's the impact? Despite the pandemic winding down, the reality is that for a significant number, the journey is far from over because health issues persist for them. That is why we're diving deep into the heart of long COVID, exploring the latest developments and discussing what's being done to help and, of course, move us forward. Let's give a huge round of applause to our moderator, Gopri Krishna Deshpande, professor at Auburn University, and get ready for an enlightening journey.
I think we have a panel.
Okay.
Do you know who's on the panel?
We had them all contact them, and I guess they're not here. So if you want, you could do like an interactive conversation.
None of them are here?
Yes. Great. Is that our panel right over there? Ah, okay, we could do handheld. Come on up, my panel. We want you. Oh, there's one. Here he comes. All right. And I'm going to let our moderator start and we can have everybody introduce themselves. Here they come. All right.
Uh, so I'm Gopi Deshpande, professor at Auburn University. And this is Sean Shakarami, founder and CEO of Sean Shakarami. Okay. And Sanjay Gupta. And I'll let you introduce yourself.
Yeah. Hello, everyone. I'm Sanjay. I'm a VP of Supply Chain at Embed Biosciences. Um, all I can say is I have a passion to save people life by bringing my expertise in supply chain, working along with medical device companies, working with health tech entrepreneurs to really bring their ideas into the commercial world.
Thank you. So the discussion today is about long COVID. Um, for those of you who are really not, maybe not familiar with what is the long, I'm sure everyone's familiar with what COVID is. The long part of COVID, basically, the science behind long COVID is so if somebody has had COVID and they basically recover from COVID, which means they no longer have the symptoms of COVID, meaning no more fever, no more respiratory symptoms, but still for months along, sometimes 6 months, year, people have been reported 2 years after. There's certain symptoms, though not enough to bother you a lot, but certain symptoms that still linger along. Things like tiredness, headache, intermittent headache, not continuous headache. The loss of smell that happens during COVID kind of never comes back. I mean, yeah, it gets better, but feel like it's never really the same. You there's certain things that you really don't smell as well as you used to do before. So the question then is, so this is basically defined as long COVID because these are the long term implications of COVID. So I mean, this is really not a very well understood topic because it's still happening. There's still long COVID. People are doing studies on that. Essentially, scientific hypothesis behind long COVID is if you've had COVID and it was pretty serious, then it means that there was some amount of hypoxia, which means lack of oxygen in the bloodstream because you couldn't really oxygenate your blood because of breathing problems. And that lack of oxygen, even though it's not enough to basically kill the cell, so it's not like stroke or heart attack where it's acute, the lack of oxygen is a little bit, but it's enough to impact the brain because brain is a very oxygen hungry organ. So when that happens, a lot of the systems in the brain, for example, the olfactory cells, which are important for smell, um, basically they were exposed to an environment of low oxygen. And basically, some of them lose those functionalities. And that's why long COVID is another name in the scientific literature. It's called brain fog, wherein you have this feeling that there's something that's not right about how you go about doing your daily life, and some of the things that you do regularly, not able to do it as you used to do before. So that's why it's also called brain fog. So this is basically the science of it, and if someone's not heard what this is, just wanted to introduce the topic. So, what we want to talk about is essentially from a care perspective, from the perspective of science and society, how the long COVID needs to be dealt with, what are its impact. I mean, remember this is still an ongoing thing, right? So we just want to have a discussion on that. So we have another panel member. So could you please introduce yourself?
My name is Dr. Felicia Baldwin, and I wanted to be a part of this discussion from a healthcare standpoint. Um, I kind of work boots on the ground in long-term care facilities and nursing homes, and we've seen a really severe impact of COVID and long COVID in the elderly. And so I wanted to be part of this discussion. I am the founder of Nurses Take the Lead. I am a advocate, leadership expert on individuals being at their best in order to give their best. I think we hear so much about science, technology, what's the best care protocols to implement to take care of patients, to take care of residents, but rarely do we hear a lot of discussion about the well-being of ourselves. And so at Nurses Take the Lead, I advocate for nurses being their best selves so they can show up the best version of themselves so that they can give the best care. And so I help organizations, leaders in organizations really focus on making sure the workforce is healthy and that we stand down to toxic work environments so that we can take care of the employees that take care of all of the patients. So I'm honored to be here today and glad to be a part of this discussion.
Thank you. So let me actually start with you because you have dealt with this on the ground from a care perspective. So tell us a little bit about how this evolved. I mean, a lot of people actually thought, okay, COVID is over, and and it's like, oh, not yet. There's still long COVID. So how did this evolve? What do you do from a care perspective? How do you care for the people with long
Okay,
COVID?
well, that's a great question. And again, going back to the well-being of the workforce to be able to care for the residents in nursing homes and skilled nursing facilities is very important. And I think sometimes because it's a double conundrum, we are short-staffed. And because we are so short-staffed, we try to sometimes bend the rules so that individuals can come to work and they can care for the residents. But in those type of group communal settings like that, where a lot of times the individuals are not leaving the campus, right? And so we continue to see new COVID cases within the doors of those organizations. So we know that it's coming from the outside. The employees are bringing it in. And so I really advocate that number one, we make sure that we are caring for our employees and making sure that they are at their best when they come to work so that for these individuals, the elderly who are immunocompromised, they're very at risk for getting COVID and any other illness, that we have to be sure that we are not the source of that. So I think that's very, very important. And I know from October to December of 2023, 50% of all COVID hospitalizations were in the category of elderly 65 years and older. So it's very important that we really try to do our best as employees within organizations not to bring it into those organizations because it, it's just difficult to explain what it looks like when you see an individual. When we talk about long COVID, we have individuals a year later, they are still not back at baseline cognitively. They are still, it exacerbates some of the dementia symptoms that we've seen already. It really impacts the quality of their life in terms of, just being able to participate in their own daily activities. And so when we talk about long COVID, we cannot not include that population, the elderly population, because their ability to bounce back from it sometimes takes a lot longer, and it impacts not only their life but the quality of their family members as well.
Well, thank you. Sanjay, any first thoughts?
Yeah, sure. I'd like to emphasize a little bit on overall manufacturing and supply chains. Um, so the people are very important aspect in medical device manufacturing. Uh, During the COVID period with the lockdown, and then the the tagging of people as essential support people in within the manufacturing. Uh, there's a lot gone from that time to now, where a lot of folks in the manufacturing uh, they are still reeling through the COVID challenges. Even if someone's have say a family member has an issue, that whole challenge comes around that is that person is going to face the similar issues which they had faced about 2 years back. Uh, we had seen the cases uh, within manufacturing, cases of heart attacks
Mhm,
where a person is very healthy, 26 years of age, 35 years of age, suddenly collapse on the manufacturing floor. And we don't know. And so we are running around EMS, bringing, you know, uh, resuscitations machines, all those things are happening around, but we don't know what exactly happened to that person. And in some cases, it points back towards the impact of COVID. And that person might have a small, COVID thing, or some blood clots, but later on it's impacting. Um, there are the cases of body aches. Uh, those poor fellows comes to the manufacturing leaders, ask for the PTO, but the rules are that if it's not declared as kind of emergency or something, it doesn't fall under the PTO or the medical criteria, and sometimes they have to really come back again next day to the work. So those are a few things which I'm observing on the manufacturing, people perspective side.
Thank you. Yeah, Sean.
Yeah, so I'd like to expand upon all the points that my colleagues have made. They're so true. One of the things that outside of my book that I wrote a little bit about, uh, I haven't spoken about this publicly, but I'm actually a survivor, overcomer of long COVID. I had long COVID before I or anyone else ever knew what long COVID was. So I had a very severe high acuity case of COVID-19 early November of 2020. I started feeling the symptoms about a day or two after Halloween. And it took me about 3 weeks to just get over the virus itself. And it was strange because for about 6 weeks afterwards, I couldn't work. I couldn't get out of bed. And fortunately, I'm a man of faith. I had just received I was working 1099. I just received a large check from a large project that I just completed. And, what we don't talk about it in small business owners is, uh, had it not been for that one check, I could have lost my business. I could have lost my whole livelihood. It took me about a year to finally start feeling right. And I remember the days where the cognitive decline, and I'm used to being a person of high intelligence, a person who can think clearly, think coherently, put strategies together. I couldn't even watch TV or read a book for about 3 or 4 months. It was just too much stimulation. And it's difficult to describe what it's like to be feeling something that when you're and look, I lean to the right, so I'm not making this a political thing, but when you grow up in a family who they don't believe COVID exists, that they believe it's a conspiracy of sorts, you're not only just questioning how you feel, but you're I was questioning my entire reality for a time. So I know what helped me the most was getting into mindfulness and really taking good care of myself from a nutrition standpoint. Nutrition, exercise, sunlight, all the normal foundations of good health is what apply applied those principles over time to finally start feeling better. I remember when I started losing weight, and that helped. There's still things to this day that I don't think will, like my sense of smell. I don't expect to ever have fully back. But also, when you talk about the implications of COVID-19, the ramifications is from a revenue cycle perspective. One of my colleagues, you spoke about the burnout and being short staffed. We have all these providers who are still running short staffed, and all this administrative work that has piled up, and our providers are focused where your focus should be on the care of the patients, but you're losing profitability, you're losing sustainability into your future. And so uh what's a little bit heartbreaking is other players in healthcare, namely the payers, have had record profits where our providers have had record burnout, inflation, and whatever I can do, even if it's small, to help turn that around to bring our providers back to profitability is why I'm here on this panel today.
Well, thank you. Couple of themes that I would like to expand on. First one, as Sanjay was mentioning, there has been some studies done with NIH support, which say that the incidence of younger people getting heart attacks have increased, and there is a correlational link to COVID, which means it's just a correlation. We don't know for sure whether it causes it, but the hypothesis is again linked to hypoxia. That if your cells have been exposed to um, a substantial amount of time with less oxygen, so they have been weakened to a certain extent. So, and one way, so the main scientific question that people are working on is there a way to reverse this? If the cells were deprived of enough oxygen for a while and we have all of these consequences, can they be subjected to a few weeks or months of hyperoxygenation, right? Then would it reverse these symptoms? Like maybe going to an oxygen bar and getting some more oxygen. And you cannot do that forever, but how about going and living in the midst of nature, wherein there's very less pollution, more oxygen, and would that basically reverse some of these things? These are some of the scientific questions that I think people are right now interested in. And I think eventually we'll know some of the answers to those questions.
Well, I would say I can only speak empirically. I'm a well-educated person, but I'm not a medical doctor, so I'm not going to try to pretend to be one up here. But it's interesting you say that because my family and I are planning to move to Southwest Florida later this year to be closer to the ocean, to be closer to live in Naples. It's a smaller city from Dallas, so a lot less pollution, cleaner air. And I will say that when I started instituting very disciplined every single day. Even traveling, I still wake up early and do my breath work practices, my meditations, my quiet times. I've noticed that a strong correlation to stress
Mhm.
makes my symptoms worse. And if I can control my stress levels and be proactive in making sure I don't have cortisol shooting through my system 24/7, which is easier said than done as a business owner. But that my symptoms are a whole lot better.
Yeah, that's very interesting. Um, any thoughts?
Yeah, again, I'm not a medical doctor, but all I can say is um, a simple living with meditation, deep breath, uh, purposeful thinking can probably help. What I had observed personally is definitely a meditation, a quiet space, maybe green room, some plants around, and just sit for half an hour, and you'll feel difference. Just move away your mind from day to day work. Take yourself a little bit stress out. Uh, bring positive thinking, and definitely deep breathe. Practice deep breathing at that time. So those are the few things which I observe. Thank you.
Thank you. I agree that meditation is important, mindfulness, reflecting back on your faith is important. All those things are fantastic. It reminds me of the reason why I started Nurses Take the Lead, because we can meditate, we can be in the best environment, we can surround ourselves with these affirmations that make us feel really well. But then we go into our workplace, and toxic workplaces will take all of that away from you very quickly, particularly if it's a culture that is known to treat the employees, the providers, caregivers in a way that is not respectful, that is not supportive. And you're absolutely right when you're talking about stress and the cortisol levels. That's exactly what happens, because as long as we're in our bubble and we're in our safe space, we are okay, but we can't live there all the time. And so that's why it's so important for us to be well in terms of our psychosocial wellness, our well being, so that every interaction that we have with one another, we are not causing any harm to each other, right? Because then our immune system can stay intact and we're not stripping people of their well-being in such a way that their stress is so high that that's when they are more vulnerable to illnesses, and also passing that on to the patient and the residents in the nursing homes. And so I think there's a lot of research that still needs to be done, because particularly for the elderly population, it's assessed as being perhaps common because of their frailty and they're a little bit older. But for some of them, it is the result of this long COVID that is, they're still kind of having like this brain fog. They can't quite pull through. When there was a time before COVID, they knew exactly what they wanted to put on every day. They knew exactly what they wanted for breakfast. And now they can't seem to tap back into that part of themselves. And we have also seen in long-term care settings where long COVID has also impacted, like you were saying, some of the heart conditions. It's exacerbating some of the baseline heart conditions, respiratory issues, even with the hyperglycemic index. With a lot of the residents, we're seeing changes that the physicians in those settings, I think, are not quite equipped yet. We don't have enough data. We don't have enough research to know really what's going on. And so we just, on some level, are not really meeting the needs of those residents as much, because it's easier to say it's because Mr. Jones is getting old, as opposed to being able to look at some other options as a result of long COVID. And we just don't have all the data yet.
Thank you. So I think, um, I mean, I'm not an expert in what's going on in the pharma industry, but I have heard that there are some potential clinical targets that people are working on, uh, and it works in animal models wherein you can basically use chemicals that are used traditionally during a stroke or a heart attack, which is essentially reoxygenation. And in a stroke or a heart attack, what's happening is a blood clot. Stroke is a blood clot that happens in the brain, a heart attack in the heart, the coronary artery. And these medications, some of them are blood thinners, or some of them are other signaling molecules which increase the availability of oxygen to the tissue. And in these cases, this is happening at the acute level. So, you want that to happen very quickly so that, you know, functionality is restored. People have tried to use these same combination of chemicals in a much lower dose taken over a longer period of time to see if that can help in reoxygenating the cells and the circulatory system, and that might have an impact in alleviating symptoms of long COVID. So that's the pharmaceutical solution to this. I mean, I know we talked about the other holistic things that we can
Yes.
do, like yoga or breathing, on holistic living, but keep in mind that there's also a pharmaceutical solution.
So, what's interesting to me is, again, not a medical doctor and just did my own research because I suffered from COVID and long COVID, is I do believe that there's a certain percentage of people who had COVID where I think oxygenation is probably one of the reasons and something that can be a good, uh, maybe pharmaceutical. I will say for me, the only thing that kept me out of the hospital was I had gotten one of those oxygen clips, and I always had good oxygen, 98, 99. For me, and I do believe COVID can attack different areas. For me, COVID was, I 100% believe no one's going to change my mind because it was in my body. I felt it in my nerves. It was a neurological manifestation of COVID. And the reason I bring up neurological is I felt like my whole body, inside of my bones, inside of my muscles, were inflamed. So I would say, from a heart perspective, maybe some people are getting inflammation in the heart causing heart attacks. For me, it really attacked my brain and my muscular skeletal system. Um, I truly believed it changed my neurobiology for the worse. And from a pharmaceutical perspective, what has helped me on top of all the mindfulness and holistic meditative practices is, um, I started a low dosage ketamine therapy protocol. And I do it under supervision of a nurse practitioner and LPC. I don't speak too much about it, but I think I've had such great results from the ketamine therapy that when you bring up pharmaceuticals and long COVID, I do think someone out there with the right credentials, not me, should be looking at some research between the neurobiology, the physical brain health, the effects of COVID, and are there drugs and therapies that can help
Mhm.
create new neural pathways in your mind to have actual healing through some sort of pharmaceutical drug.
That's an excellent point. One thing we need to keep in mind that when we are referring to some of these disorders, health conditions, we tend to think of them as kind of quite homogeneous, but they are not, right? I mean, each cancer is different, each person with a mental disorder is different. It's all individualized in nature. So, as you rightly say, um, one hypothesis is the oxygenation hypothesis, but for and as you said, I mean, a lot of people whose oxygen went into the 80s never got long COVID,
Mhm.
and a lot of people whose oxygenation never dropped below 95 still got long COVID. So there might be other manifestations of COVID, and inflammation is one of them. So so we have to look at all the different factors, maybe the oxygenation, and if inflammation is the thing, then we have anti-inflammatory medications which are pharmaceutical in nature. There are also a lot of different things that you can eat which are very anti-inflammatory in nature, which contain omega-3 fatty acids, and a lot of lifestyle changes that can reduce inflammation in the body, especially things like stress.
Right.
Cortisol increases inflammation and inflammatory pathways. So I think still a lot of research has to go into this. And interestingly, when you bring up the issue of ketamine, and I'm sure you know that ketamine is used as a drug to treat a lot of the neurological disorders.
Yep. Yep.
So, so, so potentially many of the things that are used in neurology and psychiatry, those could be used for long COVID.
At least in my perspective, from my experience, I would agree with that. At least research needs to be done.
Thank you.
All I can say is it gives a hope for the patient. At one time, there was no treatment. Now, at least there are some treatments. Definitely, if they require clinical results. But when the patients start getting these medications, it builds a good hope in them, and that helps in overall their mental state. It, they may not go into depression. They feel that there's something which can help them, and then probably the nature will take its own course and support those patients.
I just wanted to add really quickly, we cannot talk about long COVID and not really take into consideration the mental impact to the families, to the patients, because that is very real. Um, it just strips you of your well-being. It strips you of your decision making, and it really can create a burden on the families as well. And so I think a little bit more research in the area of mental health support for long COVID would really be beneficial to the healthcare industry as well.
So, has long COVID been a thing among healthcare workers? Has it impacted? What's its impact on healthcare workers?
I think we're less efficient. We just don't have the ability. I mean, you're just phenomenal for sharing your story and your testimony because we see this in healthcare all the time. You'll have someone that was before so on point, so detail oriented, so quick. In terms of critical thinking, problem solving, and you really do see a different version of that person showing up. They, of course, outside look the same, but the capacity to tap in as quickly to their excellence, their expertise, we do see a bit of a delay there. Still very capable, very able to do the job and do it competently, but we do see the struggle. There's a struggle there, and for nurses, it kind of hurts to see our colleagues like that, because we feel a sense of hopelessness, and we just don't have the information. We don't have the data yet to be able to help them in the way that they need to be helped. But yes, we do see that.
Yeah, I think that's a critical point. There's still a lot of unanswered questions in this, and we need a lot more data to answer those questions.
And if I could add one thing, I don't think brain fog does it justice of what some people like me go through. Um, it would be like you today waking up tomorrow and you don't remember that you should take a shower. And you're like, how could that possibly be? I can't answer it, but I can just say I know I went through it, and I know even to this day, I still have checklists and things that are good practices for any intelligent human being who wants to be successful. But I'm now dependent on stuff like this rather than in the past. I still have a good memory. A lot of it's come back. Like you said, it does come back when you get yourself healthy again, but it takes a long time. And I'm still dependent and have to remind myself and humble myself that my brain is a little bit duller than it used to be. And there's certain things like I still have a morning ritual checklist and it still says wake up, take a shower, brush your teeth. get dressed. Now, every morning do I need that anymore? No, I don't need it every morning. But there are some mornings where I wake up and I'm way cloudy and I remember to look at my phone and there's my checklist and at least I can get going. And that helps building those rebuilding those neural pathways in your brain, rebuilding those habits. That was one of the anchors that I use that have helped me kind of get past that part of my life.
I think it's very hopeful to know that it does get better over time, right? So, and this is we're talking about is years, correct?
Yeah, so the first year was the hardest. Um, and then I went back to work. I was got a new went back to corporate America for a little while, and became a director. And the stress level combined with long COVID increased the brain fog. But fortunately, I found a program that was actually a neuroscience program based on tapping into the state of flow. And that's where I learned a lot of these techniques that have really helped me. I would say today, I really I consider myself cured. I may not ever be the same, but that's okay. We all age, things decline, but some things get better, right? Everything's a season in life. I'd say for me, it took a good year.
Um, at this point, we can pause and maybe take some questions from the audience before moving along. Any questions so far? Yes, please.
Besides the brain fog, did you have any kind of dizziness, any kind of any other symptoms? Like what else did you experience in that?
Confusion. Does that make sense? Like just being like I couldn't watch TV without getting confused. There's a time period where now remember I got it very early on and my daughter was not even a year old. So my wife and my daughter, when I started feeling symptoms, I said, you need to go to a hotel. They went and stayed in a hotel. And I remember I said, please order me food. And my wife was like, you feel so sick you can't get out of bed? I said, one, yes, but two, I'm afraid to cook because I was afraid I was going to leave a burner on. I was very forgetful, and you just have this sense of confusion that can almost lead to severe like panic attacks because you kind of don't know where you are or what you're doing, even when you're in your own room. I had a lot of neurological effects. I could feel it inside of my.
Mm-hmm.
It felt like a burning sensation up and down my muscles for when I had like the worst and worst of the symptoms. It was inside of my nervous system. There was some vertigo. Yes.
Yes. Um, One is awareness because a lot of people might be having these symptoms but might not realize that to be something because of COVID, right? So, I mean, if you've really not heard about this term, you have all of this confusion, what is going on. Um, these are you have to understand that these are very non-specific symptoms. If you go, it's like having a headache, right? If you go to a primary care physician, I mean, there are n number of different things that might be causing this. So you don't know. I mean, they might send you to a neurologist, they might do a brain scan, that this. It's really and it's only now being defined clinically what long COVID is. But even within that definition, the non-specificity of it makes it very hard to say that somebody yes has long COVID. It's not like you can do a blood test and you'll get some number for some um, some parameter, and that determines you have long COVID. So that's one of the first challenges. And I think educating people that this thing exists and these are possible symptoms helps, because then they can actually do something about it. And that need not be just going to the doctor, as Sean was mentioning, just practicing some kind of breathing, or just trying to consciously reduce your stress levels could be helpful. So that's one thing that I think definitely needs to be done.
I would add patient advocacy and getting to a point, hopefully, where we we can at least agree on some type of classification, because going through this experience and speaking with professionals, y- you know I could go choose to be diagnosed with PTSD. I could go choose to be diagnosed with adult ADHD. But the truth of the matter is, I didn't have any of those symptoms until after COVID, and I'm not comfortable with that diagnosis, because that's not fair to me. I don't want to carry around a disability if it's not defined for what it actually came from, the root cause. And I know what I experienced, and the root cause was COVID. Uh, and did COVID change my neurobiology to where now I have adult ADHD? Probably so, but I do believe that should be diagnosed differently than someone who had ADHD earlier on. So I think patient advocacy and again, helping the awareness and the education of organizations on how to deal with people who have went through those struggles, and may need 30 minutes a day to go meditate or have self-care or whatever the case may be, so that they can live their best life.
Yeah, I just want to add a little bit on the corporate America side, or any big corporations. Stop chasing money.
Mhm.
We have we are still reeling through COVID. We have to make sure that we we give first emphasis to the people. It's like any big hurricane passing through a crowded area. Once the hurricane has passed, so much of damage has happened. It takes time to build the houses. It takes time to build the society. So same thing has happened. A big pandemic has passed, and it's still not done completely. There's still a lot of cases of COVID around. And if we say that everything is normal, I think there's something wrong. So we need to ensure that at least as the leaders and the employers of organizations to support people, and then then look at the profitability.
I think one of the greatest solutions in healthcare delivery, that's a great question from a clinical standpoint. We have to really do a bit of a paradigm shift, and we need to really start putting people before profit, because no matter how much education we provide, how much awareness we have, if we don't have the humans to do the work and to provide the service, and we take care of those providers, those direct care staff, all of our providers, then we're really in a vicious loop where we're not getting the results that we want. I think we really do have to care for individuals and put people before profit so that we can really bring humanity to another level.
One thing I would like to add, Sean was very good about actually articulating what exactly happened and understanding that this started at this time. It could be a consequence of that. I think a lot of the people won't be able to do that. From what I have, um, uh, from my interaction with physicians who have dealt with this, people are kind of have a hazy memory. They're like, did if the person comes up with long COVID symptoms, and the physician asks, when did all of this start? They are not able to say for sure that yes, this happened after my COVID. And when that happens, what does the doctor do? It's really hard. And so this inability of a lot of people to actually pinpoint what happened when in their lives and pinpoint their symptoms with some amount of specificity really adds to the complexity of the situation. That's why we need what in science we call as biomarkers. We need specific biomarkers. I don't know whether some kind of an MRI scan or some kind of an objective marker, which then say that yes, we could say some with some amount of confidence that this is really long COVID and not ADHD or PTSD.
Yeah, and I think one of the reasons I've chosen to open up about this experience is because I do want to help other people know that you're not the only one. Um, it's not your fault. May not even be fair. There, I grappled with the fairness of this. COVID doesn't choose. It's not discriminatory. It just happened. There is healing. There is a better tomorrow. It takes some work, but from a clinical perspective, I think it goes back to people and relationships, right? Because I think the only way that that could happen is if you've had a long standing relationship with your physician, and your physician can help see in the medical charts, well, your cognitive abilities, or your coronary system, or whatever the case may be, was X. We know you had COVID during this time, and shortly or a year or two after COVID, it's Y, and it's decreased 15, 20%. That should be a pretty strong indicator of potentially having long COVID.
Agree. Any other questions from the audience? Yes, please. Um, you want to say something about that?
So the only thing I can really say about type 1 diabetes in children is, uh, if you look at the ingredients that's in a lot of our food and you compare it to other European nations, I think that might explain a lot. But again, I'm not a medical doctor.
I mean, it's very difficult to establish that causality. I would say yes, it's correlational. There are a lot of things happening. For example, the CDC puts out how many Americans are diagnosed with autism, and you see what happens every decade. The latest number was one in 88. Um, it's just increasing. Why? We don't know. What are we breathing? What are we eating? How are we leading our lives? Those things have changed dramatically in the last 200 to 300 years, and that might have some contribution to it. But we still don't know, scientifically speaking, what is it that is causing the incidence of all of these things to go up. And it's very, from a scientific perspective, it's very hard to establish that causality. Sure. I mean, yeah, the association's there. It's a potential hypothesis, but we'll see what the science says in the future. Anyway, I think we are out of time, so we'll stop here. Very much thank all the members of our panel, and thank you very much for sharing your personal life story. Very inspiring. Thank you.
Thank you.
Thank you so much, guys. That was so relatable. And thank you, Sean, for sharing your story with us. Appreciate all of that insight.